So here we have the plate which shows us superficial surface of the back. Yeah? May you put your bones somewhere in the back and your bones also. So let's look here. Superficial layer of the back muscles will include two of them, 1 and 2. Yeah? First one is called trapezius. Here we have right trapezius, left trapezius, yeah? And latissimus dorsi muscle.
Okay.
So
Latissimus dorsi. This is trapezius and this is latissimus.
Yes, exactly. So trapezius muscle, it originates from our vertebral column. So it originates from all the spinous processes of thoracic vertebra, from the nuclear ligament, and from the posterior surface of the skull. Yeah. And it will be inserted to the spine of the scapula, to the acromion process, and the acromial end of the clavicle. All this information you can easily find in your atlas. There are muscular tables in the end of each part, where you can find information about. Yeah, so for example, here a couple of pages. Next page. Yeah, muscular tables like this. Yeah, from muscular tables, what you do need to know? You need to know the origin and insertion points and main actions. Yes, don't look at the innervation and blood supply because you are not, you don't know yet about nerves and blood vessels. So if when I will ask you, you will have to show the muscle, name it, and name its origin insertion points and its main actions. Okay?
Okay.
So, trapezius muscle, you can see that it has upper part and lower part, yeah? And the direction of the muscular fibers are different in these parts. So these muscular fibers, they can work simultaneously or separately from each other. So, for example, if the only upper part of the muscle is contracted, our shoulder girdle will be elevated. Yes. You can even palpate your trapezius here in the back side of your neck. Yes, and when you will move your shoulder, you will feel how it contracts. And lower part does the opposite action. Yes, it will depress your shoulder. Yeah, so we'll put it downwards. But if this muscle is contracted totally, yes, we can understand that these muscular fibers, they will pull our scapula closer to the vertebral column, yes, and will put our shoulders to the back side.
Yeah.
Latissimus dorsi, opposite, yeah, it will be originating from the spinous processes of the all lumbar vertebra, from lower 6 thoracic vertebra, from the dorsal surface of the sacrum, from the iliac crest, from the thoracolumbar fascia, and it inserts to the humerus, yeah, to the proximal part of the humerus, to the crest of the lesser tubercle of the humerus. And by this action, this muscle will be mostly adducting the humerus to our trunk, or as I have explained you before, if the humerus is fixed, if our arm is fixed, it will move our trunk closer to the arm. Yes. These muscles, they can be easily found in this part. Yeah, so when you raise your hand, yes, it is on the latissimus dorsi. Yeah, in the part. It will form the posterior wall of the axillary cavity, axillary fossa. And I suppose if you have seen some bodybuilders, yeah, sportsmen, they have these, like wings on the side.
Yeah.
Bad wings.
Buttons?
Not like bad wings.
So let's look at the next layer. Next layer of the back muscles. On this chart, both of the trapezius muscles are removed and the left latissimus dorsi is removed. What is left? So under the trapezius muscle, it was covering several muscles which are attached to the scapula. It is levator scapulae muscle, rhomboid minor, and rhomboid major. Levator scapulae muscle, it will originate from transverse processes of the cervical vertebra, and it will be inserted to the superior angle of the scapula, and it will elevate the scapula. So it's easy, the name of the muscle tells about its action. Rhomboid minor originates from lower to cervical vertebra, lower to cervical vertebra, their spinous processes. And rhomboid major, it originates from upper 4 thoracic vertebra. And both of them are attached to the medial body of the scapula. Minor is attached above the spine, and major is attached below the spine. And these muscles, they will also partially elevate the scapula and move it closer to the spine, move it medially. If we will remove both of them boys, we will see under them one more muscle. So on this part, so both the rhomboids are removed, yeah? And we can find anterior or posterior superior serratus muscle.
Yeah.
Serratus posterior superior muscle, which originates from spinous processes of the vertebra from C6 to T4 or T2, C6 T2. So it means lower to cervical and upper to thoracic vertebra, and it will be T2, T4. Oh, T2, sorry, T2. Yeah. And it will be attached to upper 4 ribs. To their angles, and this muscle, it will elevate these 4 ribs. By elevating these ribs, it will increase the volume of the thoracic cavity and help us with the inspiration. Yes. And on the other side, we have posterior inferior serratus muscle, serratus posterior inferior muscle. It will originate from vertebrae from T11 to L2, yeah? So lower to thoracic, upper to lumbar. And it will be attached to lower 4 ribs. And they will depress these ribs by this decreasing the volume of the thoracic cavity and help us to breathe out. Okay?
There's no muscle memory.
We will talk about it later. And 2 more muscles in this intermediate layer are splenius muscles.
Splenius.
Yes, there are 2 splenius muscles, splenius cervicis and splenius capitis.
Yeah.
Here you have splenius capitis and splenius cervicis.
At cervical end.
No,
Cervicis
not
and
semi-spinalis.
Splenius coli.
Splenius
Coli
capitis.
and capitis.
Splenius coli or splenius cervicis. Yes, and splenius capitis. Yes, splenius capitis. So these 2 muscles, they will be originating from thoracic vertebra mostly, and attached to splenius coli or splenius cervicis will be attached to the cervical vertebra, and this one will also go to the skull bones. Yes, and these 2 muscles, they will help with the turning our head and our neck to its own side. Yeah? What else? So that's all in this layer, yes? And then we're going to talk about the deep layer of the neck muscles, of the back muscles. Deep layer presents us